My name is Alexis DeLauder, and today I will be presenting about how to safely handle hazardous materials in the dental office. Dental professionals are exposed to hazardous materials daily at the dental office. These materials include various disinfectants, needles, and biomedical waste. Lack of training, personal protection equipment, or safety protocols can increase the chance of exposure and injury. Putting a well-structured protection program in place is critical to protect both employees and patients in the dental office. During this presentation, learners will be able to identify common hazardous materials in the dental office, use OSHA standards and CDC recommendations for safe handling, storage, and disposal of hazardous materials. They'll also be able to implement policies and protocols to reduce hazardous exposures to staff and patients. Under OSHA's Hazardous Communication Standard, any chemical that is classified as a physical hazard, a health hazard, a simple asphyxiant, combustible dust, prophoric gas, or hazard not otherwise classified is considered a hazardous chemical. Physical hazard means a chemical that is classified as posing one of the following hazardous effects: explosive, flammable, oxidizer, self-reactive, prophylactic, self-heating, organic peroxide, corrosive to metal, gas under pressure, or in contact with water, emits flammable gas. Health hazard means a chemical that is classified as posing one of the following hazardous effects: acute toxicity from any route of exposure, skin corrosion or irritation, serious eye damage or eye irritation, respiratory or skin sensitization, germ cell mutagenicity, carcinogenicity, reproductive toxicity, specific target organ toxicity, or aspiration hazard. There are many types of hazardous materials used in dentistry. Bloodborne pathogens, such as blood or bodily fluids, are considered to be a hazardous material. If a used sharp, such as a needle or blade, is contaminated with a patient's bodily fluids, that becomes a hazard for the dental clinician who comes in contact with the sharp. An exposure incident from a contaminated sharp could transmit diseases and infections. Chemicals that are used to disinfect or sterilize instruments or surfaces are also considered to be hazardous since they contain potentially harmful ingredients. An example would be the use of formaldehyde in certain disinfectants, which is a known carcinogen. Biohazardous waste, such as tissue removed during a biopsy, or even an extracted tooth, is considered a hazardous material as well and requires proper disposal. Finally, amalgam restorations are a combination of various alloys, including mercury. Due to the toxicity of mercury, if inhaled or spilled, it has its own proper protocols that must be followed when using and disposing of it. So what exactly is OSHA? OSHA is a federal agency that ensures safe and healthy working conditions by setting and enforcing standards that address potential workplace hazards. In order to ensure chemical safety in the workplace, information about the identities and hazards of the chemicals must be available and understandable to workers. OSHA's Hazard Communication Standard requires that chemical manufacturers and importers are required to evaluate the hazards of the chemicals they produce or import and prepare labels and safety data sheets to convey the hazard information to their downstream customers. The Hazard Communication Standard requires SDSs to be in a uniform format, which is 16 sections. These sheets include important information relating to the chemicals such as composition, first aid, firefighting measures, handling and storage, exposure controls, and the stability and reactivity of the chemical. The standard also requires that all employers with hazardous chemicals in their workplaces must have labels and safety data sheets for their exposed workers and train them to handle the chemicals appropriately. Employers are also required to provide appropriate PPE to staff and ensure that it fits properly. Unlike OSHA, the CDC does not have regulatory authority that extends to the enforcement of infection prevention and control in dental healthcare settings. Dental health professionals must follow local, state, and federal requirements, but many of these requirements include the recommendations that the CDC provides. The CDC has put together the Summary of Infection Prevention Practices in Dental Settings for dental offices to use as a guide for all dental health settings. The summary also includes a checklist so offices can easily check off what they already do and see what they could be working on to make sure their office is a safer place for both employees and patients. The summary goes in depth about various aspects of infection prevention, including administrative measures, training for employees, and dental line water quality. It also discusses standard precaution measures, which means treating every single patient as if they are known to be infected. Standard precautions are the minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infection status of the patient, in any setting where healthcare is delivered. These practices are designed to both protect and prevent dental health care providers from spreading infections. Standard precautions include hand hygiene, use of personal protective equipment, respiratory hygiene and cough etiquette, sharp safety, safe injection practices, sterile instruments and devices, and clean and disinfected environmental surfaces. Personal protective equipment, or PPE, refers to wearable equipment that is designed to protect dental healthcare providers from exposure or contact with infectious agents. There are many types of PPE available, including gloves, face masks, protective eyewear, face shields, and protective clothing. Employers should provide sufficient and appropriate PPE to all employees, as well as training on how to properly use the PPE. PPE should also be removed before leaving the work area, and hygiene should be performed immediately after removing gloves. For sharp safety, dental professionals should consider sharp items such as needles, scalers, burrs, lab knives, and wires that are contaminated with patient blood or saliva as potentially infective. Work practices and engineering controls should be used to prevent injuries. Needles should not be recapped by using both hands or any other technique that involves directing the point of a needle toward any part of the body. Use either a one-handed scoop technique or a mechanical device designed for holding the needle cap when recapping needles. When handling chemicals, always follow the manufacturer's SDF sheet for that specific chemical. Read the manufacturer's instructions as well for each product to ensure that you are familiar with how to safely handle the product before attempting to use it. Hazardous materials also require special storage and disposal protocols in the dental office. Used disposable syringes and needles, scalpel blades, and other sharp items should be placed in an appropriate, puncture-resistant, leak-proof container located as close as possible to the area where the items are used. These containers must also be color-coded red to warn everyone that the contents are hazardous. A single leak-resistant biohazard bag is usually adequate for containment of non-sharp regulated medical waste, such as blood-soaked gauze, extracted teeth, or body tissue, as long as the bag is sturdy and the waste can be discarded without contaminating the bag's exterior. Exterior contamination or puncturing of the bag requires placement in a second biohazardous bag. All bags should be securely closed for disposal. Extracted teeth containing dental amalgam should not be placed in a medical waste container that uses incineration for final disposal. Commercial metal recycling companies also might accept extracted teeth with metal restorations, including amalgam. State and local regulations should be consulted regarding disposal of amalgam. For storage of chemicals, the labeling must include product identifier in words, pictures, symbols, or a combination thereof, which provide at least general information regarding the hazards of the chemicals. If the office uses a secondary container, such as pouring a large container of disinfectant into smaller spray bottles, the secondary container must have all of the same information labeled. Additional information about the storage and disposal of hazardous chemicals can be found on each product's safety data sheet. Training is crucial to prepare for emergency situations. Initial hiring and annual training should address the safety and health hazards that employees should expect to find on hazardous waste cleanup sites, what control measures or techniques are effective for those hazards, what monitoring procedures are effective in characterizing exposure levels, what makes an effective employer's safety and health program, what a site safety and health plan should include, hands-on training with personal protective equipment and clothing that they may be expected to use, the contents of the OSHA standard relevant to the employee's duties and function, and employees' responsibilities under OSHA and other regulations. Eye wash stations should be located in areas where dental clinicians may be exposed to hazardous materials, such as chemicals or bodily fluid. The eye wash station will allow emergency drenching or flushing of the eyes or body during an emergency situation. A demonstration of how to use the eye wash station should occur during initial and annual training. Chemical spill kits should also be located in the office in case a hazardous material is spilled. Instructions for the spill kit should be followed exactly, and employers and employees should also receive training on how to use it properly. According to OSHA, many employers with 10 or more employees are required to keep an OSHA 300 log of occupational injuries and illnesses if the issue results in death, days away from work, restricted work, needing transferred to another job, receiving medical treatment beyond first aid, or if there's a loss of consciousness. Needle sticks from contaminated sharps also must always be recorded on the OSHA 300 log. In cases of death, the employer must report it to OSHA within 8 hours. For severe injuries such as inpatient hospitalization, amputation, or eye loss, the employer has 24 hours to report the incident. In conclusion, understanding how to properly handle hazardous materials in the dental office is extremely important in order to keep both employees and patients safe. Common hazardous materials used in dentistry can include contaminated sharps such as needles and blades, chemicals like disinfectants and sterilants, amalgam, and other biohazardous waste such as bodily tissue. It is critical that employers review both OSHA standards and CDC recommendations thoroughly to ensure that their office is practicing safe handling, storage, and disposal methods when dealing with hazardous materials. Policies and protocols need to be put into place to ensure that both staff and patients are kept safe while at the dental office. Thank you very much. I hope you were able to learn a little bit about how to properly handle hazardous materials in the dental office.